So my name's Laura Katawaki, and I'm the Research and Knowledge Mobilization Coordinator for United Way BC. So before we begin the webinar, I would like to do a land acknowledgement. And so for myself personally, I'd like to acknowledge the fact that I am currently working on the traditional, ancestral, and unceded territories of the Coquitlam First Nation. And I would encourage you all in a moment, we're going to ask you to introduce yourself, and I would encourage you to acknowledge the land that you are currently working on in BC or wherever you might be coming from. And so for the webinar, if you would like to introduce yourself, that would be wonderful. Feel free to put a comment in the chat saying your name, the organization that you're with, and then also the land that you're coming from if you know the traditional territories. For the webinar today, everyone is going to be muted while the presentations will be occurring. There will be an opportunity for questions at the end though, so feel free to put questions in our Q&A box while the presentation is ongoing, and then also feel free at the end during the question period to put questions in the chat, or you can raise your hand and ask a question then. And as you heard earlier, the webinar is being recorded and it is going to be posted on Healthy Aging Core. So you'll be able to review it later on if you'd like to see the information again or share it with others. We would encourage you to do that. And so I would like to introduce our two wonderful presenters now. So our first presenter is Kate Hosford, and she's an applied population health researcher with interests and expertise in the domains of urban aging and health cities research. She recently completed her PhD in the Faculty of Health Sciences from Simon Fraser University, and her research integrates quantitative and qualitative methods to explore research questions related to older adults' mobility, transportation solutions for an aging population, and urban environments that create healthy, sustainable, and equitable cities for people of all ages. And our second presenter is Beverly Pittman, and she's a senior regional community developer with United Way BC, where she works in the community-based senior services sector in the Vancouver Coastal Health region, and she's a member of our Healthy Aging team. Bev earned a PhD in urban and regional planning and development from UCLA, and she held a faculty position at SFU in geography and women's studies for a dozen years and worked as a consultant as well before moving into the community sector. And I'm sure many of you are familiar with the fact that she's made a lot of contributions to our seniors work in BC. And from 2008 to 2014, she held the seniors portfolio for United Way of Lower Mainland. And during that time, she was involved in co-creating the seniors-led community planning tables in the region, a seniors funding table, the Better at Home program, and the first neighborhood house-based seniors council. And of course, now she's going to be talking about her transportation work that she's been doing. All right, and so without further ado then, I'm going to stop my screen share and hand it over to Kate and Bev.
Thank you, Laura. Good morning, everyone. I'm actually going to be the one speaking first, and I'm glad to be here with Kate Hosford, who I've grown to know quite well, I think, over the last 2 years. United Way has been lucky enough to have Kate as a student in 2 roles, most recently as she completed her dissertation on seniors transportation at SFU, and at the same time held the prestigious fellowship known as the Health Systems Impact Fellowship. So lucky to have Kate here, having contributed to much of this work, and it's good to have you here, Kate, co-presenting. So the topic of our webinar is seniors transportation. You'll notice that we have a Seniors Plus. Over the time that we have been working on this in connection with the provincial Working Group on Seniors Transportation, we've seen the merit of including others besides those 65 and over, the general understanding of the seniors population, to include, for example, the also aging population of persons with disabilities. But there are other populations as well who will share increasingly the distinction, I guess, of being considered transportation disadvantaged. There's another shift here represented in our title, and it is the shift to solutions. We've spent a lot of time, as many groups, working groups may recognize, there's a tendency to do in talking about the problems. And the conversation, frankly, can get held up at the level of problems and not move beyond that. So we've made a point of now highlighting solutions. So thank you. Here is our outline. First of all, why is it important, and why today is it important to be talking about new transportation options for this seniors plus population? We're then going to recount quite a list of examples of solutions from around the world and from locally in BC. We have a list of action steps that we have compared notes with. They derive in part from the Provincial Working Group on Seniors Transportation. And then, as Laura indicated, we plan to leave time for questions and answer period. And I'd invite you again to put a question anywhere along the line in the chat or in the Q&A, whichever it was that Laura indicated, so we can return to them at the end. So the importance of seniors transportation, I think, will be clear to many of you. Just to bring them to your attention quickly at the beginning here, this is a time of population aging. Never in the world's history have we seen so many people over the age of 75. You can see from the first graphic on the left that by the year 2037, a mere 13 years out, across Canada, 10.4 million people will be above the age of 65, and roughly half of that are going to be above the age of 75. And that is significant. That number 75 is significant because in BC, we understand it to be the average age for driving cessation. The next graphic is the front cover of a report conducted by the National Institute on Aging. It's about aging in the right place, and we will be arguing, as others are now with us, that the right place includes one endowed with transportation services that are age-friendly. They're available, they're affordable, they're accessible, and so on. And finally, as Laura indicated, transportation solutions are needed because they're important for reasons of health. Transportation is a key determinant of health, and many people, including the World Health Organization, from which this diagram comes, call it out as a specific social or key determinant of health. As I mentioned, a couple of years ago, there was created a provincial working group on seniors transportation. It has representation across BC. And at the time it was created, it was just following a large set of consultations across BC in which various transportation challenges seniors were experiencing were identified. And this is the ranking from left to right of the severity of the issue. Most important for the seniors transportation working group to address, therefore, became number one, transportation to medical appointments. Next was public transit or public transportation. There's many communities without it, many that do not have age-friendly services in a number of ways. Paratransit, for example, the well-known HandyDART, available in some parts of the province, but not all, is often unavailable. And here's this huge program problem, which is looming and is not upon us immediately, hence its placement fourth in line, driving cessation, with the baby boom population aging, the front end now 75 or 76, and therefore on that average age of driving cessation, this is a problem coming down the road for us. Pedestrian safety and active transportation at the bottom, understandably. But if you think again of seniors' health, you'll know the importance of a daily walk and age-friendly conditions in which to do that walking in. And the next slide, please. I wanted to draw attention to the fact that the Provincial Working Group on Seniors Transportation, which has discussed these problems thoroughly, and in the last year has turned to discuss the solutions, has been paralleled by a project funded by the Vancouver Foundation and co-led by BEST, Better Environmentally Sound Transportation, and United Way. It's called Seniors on the Move. The idea is to raise awareness of the lack of options for seniors to get around, especially after they hang up the keys, to increase the options available, potentially through some solutions that we're going to be outlining today, and to ease the transition from driving to these other options. This is what Seniors on the Move in particular is about. I want to turn back to now a project that was jointly carried out by the Provincial Working Group. Kate was involved, as well as BEST. And it was a provincial consultation held in September of 21, just on driving cessation, life without driving. And it drew attention to the real fears many people hold about what gives, what will they do after they can no longer drive, and they live, like we all do, in cities or communities built around the automobile. So, as you've heard, I hope we are shifting the focus in this webinar more than any other time in our work to date to the focus on solutions. I'm going to be handing it over to Kate after this slide. I just want to indicate that Kate will be taking you through a number of significant international examples, some provincial examples, small town examples, and mention, I think, in briefly an example the Seniors Advocates Office has developed. Kate.
All right, so thanks, Bev. As Bev mentioned, I'll start with some examples that we've come across in other parts of the world and then go into those from BC. The goal is to give you a taste of different initiatives that we've come across, but we won't be going into details on any of them. So feel free to ask more questions in the Q&A if they come up. To start, we wanted to share some work that came from an international scan. This scan was conducted by O'Hara Consulting in partnership with Help Age Canada and the Samuel Centre for Social Connectedness. And the report that they wrote on this is pictured here. They looked for examples around the world, and in it, they were considering 3 different types of innovation. Partnership innovations, so that could be partnerships between the public, private, or nonprofit sector, different policy innovations around insurance policies, or technology innovations. And so that's how they categorized innovation. So I'll share 3 examples that came from this report. The first is ITN America, and this is a national nonprofit for seniors transportation network of service providers for seniors and people with visual impairments. It operates through an affiliate system where ITN America helps communities develop their own local transportation system, and then ITN supports them on an ongoing basis by providing access to education, resources, and a software system for scheduling trips. The specifics of each of the services vary by community to community, but in general, they strive to provide service that's 7 days a week. They offer, drivers are volunteer mainly, but also there's some communities that offer paid drivers. One thing that's good about this service is they offer the door-through-door service and provide help with carrying bags and packages, which is something that we've noticed that not all services provide. Sometimes it's just curb to curb. So this is, I think, a nice feature of their program. It's available for any trip purpose. And then another innovative aspect of this program is that they use a personal transportation account. So all trips are booked and reserved and paid for through this account. No money is exchanged when you get in the car. And then part of this is also a ride credit system where people can earn credits for being a volunteer driver. So if you provide trips, you can get credits banked in your system so that later on, if you need to use a service, that you would already have credits and wouldn't have to pay for the service. And you can also, at some affiliate organizations, trade in your car. So if you're giving up your driver's license, you could have the organization sell your car, and then the money that comes from that would go into your credit system for future trips. A second initiative that serviced from the scan is Ride at 50 Plus, and the innovative aspect of this feature is providing that centralized booking pair and book their trips across public, private, and non-transportation options. I think something we often hear is that it's there's lots of these services out there, but it's hard to figure out which one to use, and so this consolidates it all into one website. Rides can be booked via an app, website, or calling in if you aren't comfortable, but they do provide digital training for people to learn how to book trips themselves on the app or the website. And then it's this partnership between AARP, Phoenix Mobility Rising, and Toyota, who's the funder. And lastly is an initiative called PlusBus. So this comes from the Netherlands. It was founded by a national foundation, the National Foundation for the Elderly, and they work with local municipalities to lease buses in the communities, and they work with them in the first year to provide funding and help them look for diversified funding services so that they can continue to offer this service more in the long term. Again, the implementation will vary from community to community depending on what they decide they want to offer, but a primary goal of PlusBus is really centered around social connectedness. So they often combine their trips with, their trips are often group-based, and they work to try and combine the essential trip with the social trip. So it might be going to get groceries and then having coffee in addition. So their trips are generally like that. A few key takeaways that came from this scan were that the initiatives were national in scale but had local implementation. I think this allowed for some flexibility in how the services were delivered depending on the needs of community, but then at the same time you could benefit from the resources of a larger organization that had experience operating these services in different places. A second is this multi-sectoral funding. The project emphasized that in Canada, we often look for grants from the public sector, but in other places, it's more common to get funding from the private sector or just businesses and things like that. And then thirdly, to emphasize the secondary benefits of the program, I think all programs really recognized the benefits that these programs offered for the health and social well-being of older adults, and this will help attract more funding and provide a greater purpose for the trip beyond just transportation from A to B. And lastly, it was important that each of these services had technology that was relatively easy and affordable to use, and this allowed the service to work kind of seamlessly across different communities. So the next set of examples come from a provincial scan of community-based transportation services. So this is work that was initiated by the Provincial Working Group on Seniors Transportation that Bev was mentioning earlier. And the goal was to identify these community-based services that were in BC. So community-based being services outside of the conventional public transportation system that were offered by municipalities or nonprofits. The two specific objectives we had were to profile successful or promising models of seniors transportation in the province, and then secondly, to learn what facilitates or impedes the success of these services. So using a selection criteria, we landed on these 4 cases. 2 were run by municipalities, the Zunga Bus and the Delta Seniors Bus, and the other 4 were operated by nonprofits. So starting with the Delta Seniors Bus, it's a municipally funded and operated service right now. It offers curbside pickup and drop off for all trip purposes. The target audiences are seniors age 65 plus living in Delta, and it can provide trips anywhere in Delta. Some exceptions are made for medical appointments beyond that boundary. Offered 5 days a week, 9 a.m. to 4 p.m. And then they do rent their bus outside of those normal operating hours for special events and things like that. The cost for seniors is free. And I think what stands out about this service is that the initial funding did come from this New Horizons grant, but then they are eventually able to build in the ongoing funding and maintenance for gas and staff are built into the city's annual operating budget. And this helps with the sustainability of the service. And staff for this service in particular, staff commented that it was successful at helping older adults maintain their independence and be socially connected, but it was also really important for relieving some of the pressure off of friends and family from providing transportation during weekdays. The second service that we were really excited about was the Zunga Bus. So this is an on-demand public transportation service for all trip purposes in Powell River. On-demand being that you can book a trip in the moment and wait anywhere between 5 to 30 minutes for your ride and go anywhere within a designated service area. It was targeted at youth, seniors, and others who couldn't use the fixed route public transportation service easily, but anyone in the community could book a ride. Offered 7 days a week, 11 a.m. to 6:30 p.m. And the cost was $225 per trip, which was the same as the fixed route public transportation service in that community. For me, what stood out about this service was that it really challenged people's perceptions of what public transit could be like. It was like a cool initiative. People were excited about it. In one testimonial, one person said that they were excited for when their grandchildren were visiting to take them on this bus just to try it. So it was something that people were excited about. And then I think what also really came through is this, it had seniors in mind in the design, but it was open for everyone. And I think this kind of allowed just intergenerational connection and lots of different people to benefit from the service. It was initially implemented as part of their sustainability plan to get more people taking public transit, but they soon realized the social benefits of this service were huge. And I think when they're advocating for the service to be continued, they also tied it to their poverty reduction strategy. And that was really key for seeing those intersectoral benefits. So one example is that it just allowed people to make those spontaneous trips to regular things, which can be hard to do when you have to for some paratransit services, you have to book 24 hours or more in advance. So this local said that they use it all the time. They aren't able to drive and have trouble walking, and they just use it to meet friends for coffee, regular things, and it allows them to get out. And then, as mentioned earlier, the benefits extended to other population groups. So the first quote is from someone with a disability who said they had lost the ability to drive, and that the Zunga Bus now allows them to get out every day rather than just once a week or once a month. Benefits were also seen for parents who didn't have a car or youth who were traveling to summer jobs who couldn't get their parents to drive them back and forth. The Zunga Bus is just one of many different on-demand pilots being launched across the country. So this map shows, I think, 25 plus on-demand services that have launched since 2015. I think it's a really exciting area to watch, and some of these services are being designed specifically with seniors in mind, such as Edmonton. I think they incorporate stops at seniors' residences in their on-demand scheme. And then York Region also has a few different, in Ontario, also has a few different options that are targeted at seniors. So I think watching how those work and making sure that older adults' needs are being kept top of mind in these on-demand public transportation services will be important. So the other 4 services that were featured in this report, and you can go to the report for more details on them, were operated by nonprofits. It included Step Up and Ride Society, which is a great example of a nonprofit paratransit service in Dawson Creek in BC. RC, Richmond Cares, Richmond Gives volunteer driver program, another good example of a volunteer driver program in BC. And then Collingwood Senior Shuttles and the Seniors Go Bus were examples of neighborhood-based shuttles for older adults. And I think what I wanted to highlight here is that even though we're talking about innovation, I think it's important to highlight that there's some futures of services, basic futures of services that shouldn't be lost. And I think nonprofit organizations often start their service because there's a gap in the community. So they're pretty attuned to what is needed. And some of the facilitators to their success that were mentioned when we were talking with service providers were just having a really streamlined intake process. Not all of them were technology heavy, but they just made it as easy as possible for seniors to sign up for the service, providing frequent and regular service. So the Seniors Go Bus and Collingwood Senior Shuttle both commented on how, due to limited funding, at one point they had to reduce their service from 3 to 2 days per week. And this had a really negative impact on older adults' ability, or it just made it a less useful service. So as much as possible, maintaining consistent weekday service is helpful if it can be done. Across all services, drivers were particularly important to the success of these services. So you needed someone who was a good driver, but also had a caring and empathetic demeanor. And the driver can really make the program, but it's also really hard to find good drivers, whether paid or unpaid. Core funding for these services is really helpful, such as Better at Home is helpful for providing that consistent funding, but rising transportation costs make it hard for that core funding to cover that. So just having more options for core funding would be helpful. And then all of the organizations mentioned partnering with other organizations, and this helps with different organizations in the community just being aware that the service is offered, and then they can get more referrals for the service and things like that. So now I'm going to pass it over back to Bev, who will share an example of a small town's approach to creating a transportation system in their community.
Thanks, Kate. Fraser Lake is located dead center in British Columbia, or about a 2 hours drive west of Prince George, 150 kilometers. A small town. It has a population within the town limits of 1,100 and in the surrounding area of 2,500. This little place has been successful since 2017 and 2018 in introducing 4 of the 5 services you see in front of you. So there has been a lot of success in securing the transportation options for seniors and others in the community. And we're just going to run through them quite quickly. So you see 5, the names are called out. You see pictures, photos on the right of each of those in turn. So 2 of them are 2 big intercity buses. That would be BC Bus North, and at the bottom, the Northern Health Bus. And then there's another that's a van, and then passenger size ones. So I just wanted to give a shout out to my colleague, Sarah Story here. She is the regional community developer for Northern BC. She's also the mayor of Fraser Lake. She has had a hand in bringing these services to town. So the next photo is of the Fraser Lake Community Transportation Program. It offers services to community members, including seniors, 2 days a week. And on the next slide, we'll see the route that this, let's see, it's a 6-passenger van. No, it isn't. It's an 11-passenger Mercedes Sprinter van, and it operates partially on an on-demand basis late in the day. So here's Route 1. Not going to spend too much time on it, but you can see that it goes from the south, let's see, bottom right corner at the beginning of the day and arrives at Fraser Lake town site later, and then it does the return, arriving back where it started. And then here's the second route, and it runs from the town site of Fraser Lake, which you see bottom right corner again, farther west, and it goes so far as I think it is Smithers in this case. Yeah. Okay, that now I'm going to do this quite quickly. I'm looking at the time. Now we turn to that second bus in on the list. This is the Autumn Services Get Up and Go program. It is this is the 6-person van. It is owned and operated now by Autumn Services, the community-based senior service organization in town that offers, amongst other services, the Better at Home program. And you can see that wheelchair access there. This is serving mostly seniors. And the next is one of these big coaches. You can see this is the BC Bus North. It was introduced in 2018 after a plan for Highway 16 following the murders and the missing and murdered women of the so-called Highway of Tears. This was the response. And so that's a large number of communities west of Prince George, including Fraser Health. And the next is BC Transit's offering in the region also since 2017-2018. This is the Bulkley-Nechako Regional Transit System, and the communities along the highway lobbied for this from BC Transit. It was a partnership that involved quite a few players, and I call these out in case their equivalents may be partners you could think of in your part of BC. So as well as BC Transit, it was Pacific Western Transportation Company, so there would be an equivalent locally for you, plus the municipalities I mentioned, plus the First Nations, all of them partnered to and made possible this service. And next, another kind of social infrastructure, if you will, that facilitates and enables the introduction of new transportation solutions are seniors. Don't forget the seniors. The Provincial Working Group and the Seniors on the Move project partnered. These people, 2 of them at least, serve as seniors advisory members to the projects. Mary Wilson on the left is known for her work as an advocate around walking in New Westminster. I wish I had time to go into details, but I don't think I do. David Dunn, next in line, has led a professional life with BCAA and in other capacities that furthered the age-friendly nature of the whole process through driving cessation, amongst a great many other things. And Mario's last name is Gregario, and he's been serving for some time as an advocate on the TransLinks Accessibility Committee. He wears a sign. You can see him on the buses, and he indicates that he has a cognitive disorder and asks others give their seat to him and others in his situation. So the next slide is moving on now to some steps that the working group and Kate and I put our heads together are suggesting that you out in British Columbia, no matter where you live, may want to consider taking. So the first is to do some research, conduct some research on the age-friendly community plan in your community, if there is one. Chances are good that if it is of any size at all, you will have an age-friendly community plan. And in it, you will see recommendations regarding transportation improvements. See whether they are up to date and you can support them. And then if that's the case, approach your equivalent of City Hall, find out who is the local, who are local champions and partner with them. Another step, identified vehicles that are not used to their utmost in the community. Maybe it's with the local school board, school buses, and there's some arrangement that you can make there to turn them over for use in the middle of the day for seniors and others. Partner with persons with disabilities organizations, and do that now, given that the BC Accessibility Act has an ongoing public engagement process. They've reached that stage. There are local committees being formed. You could become a member. Here's our shout out to the seniors transportation advocates and other mobility activists. Talk to your local MLA after you figure out what you want to advocate for in the way of solutions locally. Maybe it's the Zunga bus. Research funding opportunities and apply. You just might be rewarded. On the next slide, and this is our final slide, we have a list of some funding opportunities that are available. This is not a complete list, but they all can be tailored to transportation. Some are right on transportation, but New Horizons for Seniors, that $25,000 annual community grant, has in the past been used to do needs assessments for seniors in communities around transportation services, and also some planning led by seniors. ICBC has community grants, I believe, on an ongoing or revolving basis. In the case of United Way BC, our healthy aging team is developing a grant called Now that will include transportation innovation. The details are not yet available, and it is a local Better at Home program. Most typically, we think that we'll be actually making the grant application. So if you're not part of that organization, perhaps reach out and meet them. BC's age-friendly community grants are available again each year. Transportation is squarely in their remit. BC Active Infrastructure Transportation Grants programs are huge grants. They are for infrastructure. They do need to be for projects that are shovel ready, but know as well that 74% of all BC communities do have an active transportation plan in place now, and that ought to be age-friendly and include seniors. So I think that should be BC Active Transportation Infrastructure Grants Programs. And the last, I wanted to mention quickly that there was a grant call. It has just closed with the Island Coastal Trust Society, or the trust. And I know that the Sunshine Coast Seniors-Led Planning Table partnered with others on the coast, Seashelt and Gibsons in particular, made an application for an assessment and for the development of an action plan, and just filed that. I wish them good luck on it. And the next slide is, I believe, a thank you and ask for any questions you might have. So here, if I'm understanding correctly, Laura, Kate and I are going to turn it over to Laura to identify questions that have been posed in the chat and the Q&A. Thanks, Laura.
Yeah, thank you so much, Bev. Thank you and Kate for that really inspiring presentation with those solutions that you presented, and then also the really practical tips at the end regarding how people might be able to get started. And so I would encourage people, if you have a question, you can put it in the chat box or the Q&A box, or if you want to come on camera, you can raise your hand and ask it to our presenter person, or I guess online in person. So I'll give folks a moment to get any questions they have in the chat. And I just did want to note, because there was one question about the recording. So the webinar is being recorded, and we will be sharing that on Healthy Aging Core. And then also, as you saw in the presentation, some of this work is built, for example, on that report Kate did with the very interesting case studies. And there was also a literature review reference. So I think we can see about if we can send out those links to you afterwards, so that you can go through them in more detail, because I'm sure they include a lot more information than what was able to be covered in this presentation. And then while I give for people oh, I see there's already comment, oh, would love the links to the reports and lit review. Yes, we'll definitely provide those. And then while people are getting their questions in, maybe I could start off with a question. So I was really interested by the fact that in that Zunga bus examples and also some of the other examples you provided about the potential for seniors focused transportation solutions, but then also thinking about how we can incorporate other people in the community in those solutions as well, and thinking about that intergenerational aspect. And I was wondering, in regards to that intergenerational aspect, how you think we can have students or younger people, because we know they're also another key age group who often might be using public transportation a lot and not have access to transportation. And so how you think we could have seniors advocates and other organizations work more with those other populations who also have challenges accessing transportation.
Kate, feel free.
Okay. No, I think that's a great suggestion that like when you extend from just seniors, there's so many other populations that need access to transportation, including youth, others who don't have a car, people with disabilities. And so if there's more of a collective call for better transportation, I think that that just makes the case even greater. Yeah, I don't know, Bev, do you have any specific ideas about how the champions could be expanded to different groups?
I'll take a shot at it. It's a good question, Laura. And as you know, in intergenerational, anything in the senior sector is so far quite aspirational rather than commonplace. But there is a venue in which people of all age groups are coming together to talk about transportation and its shortcomings and the need to make the services accessible. And that's the public engagement process that is unrolling right now around the accessibility, the quite new Accessibility Act in BC. It's 2 years old. They are in the public engagement stage, and persons with disabilities are attending those meetings and reporting out as they should. So are older adults. And I imagine that there are non-drivers, including youth. I don't know that for a fact, but that is, clearly not age restricted and could be attracting a mixed group. I hope so.
Thanks for that additional information, Bev. And then perhaps we can also send out to the participants afterwards some information about that BC Accessibility Act engagement and how they can get involved and learn more about it.
Okay.
And then I see we have a few questions now. So one of the questions that we have is about the Zunga bus and whether it drops people off at specific locations. So for example, directly to the door of a doctor's appointment or a friend's house.
Yeah, so the Zunga bus, so long as that doctor's or friend's house is in the designated service area that they've identified, it does do that door-to-door service. I think there's sections outside the service area that it couldn't go to, but it does do the door-to-door specific location drop-off.
All right, and then we have another question about that bus as well. So is that entirely user-funded?
I don't believe so. I think it's subsidized. Initially, it started through a federal grant. I can't quite remember the name of the grant off the top of my head, but a federal grant like for innovation got it started. And then they also got maybe some additional funding for it. And now I believe they're getting some funding from the provincial government to continue the pilot. And the provincial government is going to take in that information and kind of make a recommendation on how they might fund on demand or not across the province. So I think so far it's received grant funding and public funding, but the longer term sustainability of the funding is a little bit up in the air at the moment.
I can tell you, if I can just interject quickly, after Kate and I wrote the Promising Models for Seniors Transportation in British Columbia report, it has always been the Zunga bus that has caught people's interest. In fact, we made a presentation to the Sunshine Coast Regional District Transportation Committee because of the proximity. They were just south of Powell River, which of course is where the Zunga bus is being experimented with. But there's a lot of interest in that model in particular. And I think BC Transit recognizes that.
Thanks for that additional information. It definitely has a very catchy name as well. So sounds very fun.
One thing to add about the name that goes back to kind of community implementation was, so Zunga refers to a makeshift rope swing, and it's a term that's specific to Powell River. That's like where it's known for these rope swings. And so they came up with the name Zunga as a fun way to swing from A to B. That's how the name came to be. And so it's kind of a nice name.
Oh, that's interesting.
Yeah.
All right, and so we have some additional questions. So Lynn was asking if there's any examples that you found from the Kootenay region.
I know that the Kootenay region has been active in the past. I am not right up to date on what they have going. I know that there was a point in time when I was making phone calls after learning about the fact that they had received funding for us. I don't know if it was a van or a shuttle bus, to see whether we could get I could line up for them one of the first electric buses in Vancouver. And there was none at the time. This was about a year ago, and no, they were not taking orders. But I mention this because we haven't so far. It seems to me that when we do equip seniors, as we must, because so many are going to age in place, and then what are they going to do to fetch the groceries, et cetera, that we have to be thinking of green or non-fossil fueled vehicles, the small shuttle buses and vans. In the near future, they're going to be electric. And just we can solve two problems with one electric van if we do it the right way.
Yeah, that's a really interesting point, Beth. And then we have another question from another Lynn asking, we identified underutilized vans and promoted their availability, but found a shortage of volunteer drivers with the appropriate class of license. So are you aware of any grant-funded projects that can subsidize the training for volunteers who want to obtain that Class 7 license, and also to train them to help disabled passengers in return for some service time as volunteers? So do you know any examples of organizations or resources for this?
I do not. I think that the case could be made to finance that through the BC Active Transportation Infrastructure Grant, but I'm not absolutely certain. And I say that because active transportation is not just walking and cycling. It also includes building out active transportation networks, which in turn can be a shuttle bus or a small van. And then in order to bring about the highly desired connectivity in the active transportation network, there could be a piece that would secure funding for the training. So that's not a sure thing. That's something I would inquire about through the BC Active Transportation Infrastructure folks online. They're very accessible. Another opportunity, I believe, but you will know, most of you on the line, I think, that New Horizons for Seniors $25,000 grants is only that size. But if you are training seniors to fill this volunteer role, and depending on the cost of the training, I think that you could make a good case for that as well. Any other ideas, Kate? Do you know?
I don't know of any specific organizations, but I think it's a really great suggestion. And out of the Provincial Models report, kind of one of the recommendations was that maybe there should be some sort of provincial approach to training drivers or people who work with older adults, because it seemed to be there was a shortage even in the public sector for drivers. So I think having some training program that supports people to get these licenses, but also trains them on how to work with people with disabilities and with different needs would be, a great step.
Yeah, I might have mentioned the United Way Healthy Aging grant that is going to be available quite soon, that on transportation innovation. Again, depending on the cost of training, that to me, on the face of it, seems like it could be a candidate for that funding. And again, we don't know the size of those grants yet. But it is a BC-wide problem that's been identified here. It needs a solution.
Yeah, thank you, Bev and Kate. And then the next question kind of builds on the last question. And the person is asking that they know there's considerable challenges with getting volunteer drivers sometimes, but also there are challenges and expenses with having paid drivers. And so they were wondering if you have any insights regarding those challenges or expenses that might be associated with if you want to have a paid driver.
Yeah, it's the case that transportation has not been recognized in the community sector until recently as something deserving of funding. Now, with the baby boomers aging out of driving in the near future, we really have to come to grips, and we need to create new funding sources to manage this problem. What I can offer, again, I guess, is the United Way funding in two regards. There is in the works, many will know, I think, a Better at Home. It's an expanded version of the non-medical home support found in 90 plus communities across BC. One of those enhancements, and there is funding available for it, I've said, is innovation around transportation. Another is around volunteers. And in that grant, there would be means to support a nonprofit's current activities in recruiting and training and retaining volunteers, including for volunteer driving for the organization and the program.
And I'll just add, so I spoke to a couple of organizations who were pretty, had tried the volunteer system, and then they switched to paid because they felt that was just easier to manage and provided more consistent service. And although they liked the paid model, I think it was hard to find people who were willing to work part-time, because often these roles were only 3 days a week, and sometimes there was downtime in the middle of the day. And so just finding someone with that flexibility. And then what was the other one? There was, I think sometimes the drivers are paid in the community sector, there's just not enough funds to pay them as well as maybe in the public sector. And so just finding someone who's willing to work those part-time hours at a wage that can be afforded by the community organizations were a couple of challenges that came up there.
Mm-hmm. I saw the question come, if I can jump to it, about what is innovative transportation. And I'll say one more thing first, and that is any organization, including the Better at Home program, that applies for the innovative transportation funding needs to document, needs to demonstrate that they are in a transportation desert. So that's a concept that's out there. You can Google it and find more. But for example, Fraser Lake, it was effectively a transportation desert. It had no transit. It had no cabs or taxis, no rideshare like Uber or Lyft around. And it was a long ways, 2 hours at least, to doctors and dentists, and a 24-hour clinic, or at least no eye doctors. Local GPs, apparently. But that's one prerequisite. As it relates to the definition of innovation. I think we're going to be generous. So it does not have to be the newest and the brightest or shiniest thing. That is my sense. It's also aspirational. If you can be innovative, we certainly need innovation in this front. So go to it, but don't give up because you really just need volunteer driver training. So that if you can find, if you can develop a clever way to push people through, support people through the training, that would be really valuable for the rest of us to learn from.
Thanks for that additional context, Bev. And another question that we have now is, how do the on-demand transit options in rural locations navigate scheduling the pickup times and pickup windows for the people they're picking up?
Yeah, Kate, would you like to go first?
Sure. So these are managed by background software that the bus is equipped with. And so just as rides come in, they route the most efficient algorithm to, it shows you the ride is needed here and it tells the driver where to go. So it's all powered by a software company. And I think there's lots of different ones out there. I can't remember specifically what the Zunga bus was using, but and what's interesting about these algorithms is that you can tweak them so that you can say, I want to prioritize efficiency, so getting people from point A to point B as quick as possible. Or you can say, like, to align with more of your sustainability goals, to tweak it to more wanting to pool rides. So maybe people won't be getting where they want to go as fast, but then you're being more sustainable in how you're getting people. So you would work on pooling trips in that case, which I thought was interesting.
Mm-hmm. The way they do it in Fraser Lake, I think it's the Community Transportation Program, the very top of the list. They have a combination of fixed route services up until mid-afternoon, after which they shift to on demand. And so that's another way to handle it. I don't know whether they use the same technology, but there is that division of labor, so you can reliably expect this vehicle to stop along the way at a certain point in time. But late in the afternoon, it is more flexibly dispatched.
All right, great. And we have a few more questions, and I know we're close to the end, but if Kate and Bev, are you able to stay on for a couple more minutes so we can finish up the last questions?
Yes, I can.
All right, great. And if anybody has to leave at this time, of course, feel free. So we have a question from Brian. Do you know of any rural areas where the school busing system is used for seniors at the same time as collecting and returning students during the morning and afternoon?
So one example is Step Up and Ride Society, which was highlighted in that report. They offer both. So they do transport for schools, I believe, as well as for seniors. Mm-hmm. Any others come to mind, Bev?
No, but do they use the school bus?
That's a good question. I think I'm not totally certain whether it's the same vehicle used for both, but I guess I know their organization does both of these.
Yeah, I've been working in this area for a long time, and the availability of empty school buses for so many hours during the day has been recognized time and time again. Well, that's an underutilized vehicle, or if not a fleet of vehicles, I think that we might be approaching the time when the school districts can rationalize it, and others will be pushing them to use those vehicles. At the same time, I hope that they become electrified, but they are definitely underutilized transportation resources at the present time. They have their reasons for not sharing them readily. I don't know the ups and downs, but I think that the things might change around that, and I hope so.
Yeah, that definitely seems like it would be a worthwhile endeavor to try and get those school buses involved in the transportation. And we have another more kind of technical question from someone asking whether HandyDART bus services, do you know, are they able to cover both Vancouver Coastal Health and Fraser Health regions? So can they move in between the regions and do trips between the regions?
Oh, it's a technical one. You're right. I think the dispatchers, I'm sure there's instances. I don't know whether it's a regular practice. I've definitely heard during COVID that there were challenges getting people on HandyDART in Maple Ridge down to the health or hospital precinct on Vancouver's downtown peninsula, or I guess across from it. I don't know. Sorry.
Yeah, so that one's maybe the person who asked it can ask HandyDART or TransLink, and they might be able to have the answer
Yeah,
for that one.
I'm going to find out. I ought to know. I know that HandyDART does not reach all parts of Fraser Health, and there are people that are advocating for further coverage in Langley, for example. There's a strong group there of advocates.
All right, thanks. And then our next question is whether there is anybody who has explored incentives for volunteers with insurance, because that's a cost for volunteer drivers. And perhaps there could be something like the credit system used by one of the models presented, and maybe ICBC could help with this process.
Yes, interesting questions. There was a time about 8 years ago when we did a feasibility study on the ITN America model to see whether it could be hosted in Canada, and the business. The figures did not come through for a business plan. But still, there are things that we can learn from, and the insurance piece is important as it relates to all kinds of volunteers, actually, specific ones, of course, for drivers, but nevertheless, insurance enters into the volunteer equation. At United Way, as part of the Better at Home, we are going to be boosting the engagement of our volunteer team. We have 2 people who currently staff the volunteer online platform, and there is going to be closer engagement and therefore recognition of the needs, and we hope responses to the needs of the CBSS sector as it relates to volunteers, including insurance. So that's down the line, and it's hoped for rather than a sure thing. I hope that helps. We do recognize it's an issue, and I can say that we do have a member of ICBC, the fellow behind the community grants, on our provincial working group, and we're working with him to identify the transportation deserts right now, actually.
All right, great. And then the next question we have is, how active is the provincial government in monitoring the Zunga bus as a model? So is it something they're aware of or involved
in? So I believe this falls under the transit branch of the Ministry of Transportation and Infrastructure who's monitoring it. And I think they're looking at one in Kelowna that BC Transit is leading, and then the other being the Zunga bus. So I'm not sure how active that involvement is, but I know that that's where it resides, and probably where you could follow up if you wanted to get more information.
Yeah, I would suggest if you're in the Kootenays or another part of rural BC that you connect with your local BC Transit representative, and after looking into Zunga some more on your own, and by reading the Promising Models report, the passages about the Zunga there, and then start taking those steps and advocate for a Zunga if you think it's a Zunga that you need, but put that name in the air. At least this is the whole push that we're trying to mount now. Kate and I talk about the solutions. They are out there, and bring them into your local community or your region, and involve your MLA. The Zunga, that name, it holds on. It's a catchy name.
Thank you for that call to action. And then we have 2 last questions. So one of them is Lori's noting that HandyDART is underutilized in her area because there's no evening or weekend service, and same with vans that are run by private and public care facilities. And she's wondering if you know of any areas where these systems and transportation options have been made available. So, for example, allowing people to rent the Handy Dart or those private or public vans.
I haven't. It's a good idea. It speaks to the underutilized nature. It should. You would think it. I would hope it would prompt, Handy Dart to extend the hours. There's a unionized workforce there, and they're protecting the quality of life of their workers. But perhaps a shift might be considered. Within the union guidelines. We just need to get more of these, and whether it's through Handy Dart or other means like the one in Dawson Creek, we just have to find ways.
All right, thank you. And then going back to the Zunga bus, the last questions we have is how do they give people an expected pickup time? And then there was also a question, is Zunga copywritten?
So I think it's all, you get a pickup time on the app. If you're using the app, you just say where you want to go, and then you'll get estimated pickup time and drop off. If you're calling in because you're not using an app, I imagine that the dispatcher would just let you know that your pickup time is in 25 minutes.
Yeah, I see a note from Lynn Shepherd, who lives in Vancouver. She's drawing our attention to the fact that there is an underutilized vehicle that is currently being rented. So if you're in the Vancouver area looking for a shuttle bus, you could rent one from Ask Friendship Society. The Ask gives you an indication of the geography. It is the Arbutus, Shaughnessy, Kerrisdale Friendship Society. So yeah, look them up. Thanks for drawing our attention to that, Lynn.
All right, well, in that case, we're at the end of the questions. So I think we can see by the discussion today that a lot of people are really engaged and interested in the transportation topic. So I really want to thank you, Kate and Bev, for this amazing presentation and information. And as I mentioned, we'll be sending out the recording afterwards so people can review that. And then we'll also send out some of the resources and information that we mentioned. And hopefully you'll be able to take this then to your communities and perhaps develop or implement some innovative transportation solutions yourself. So thank you everyone today for attending and also for bringing all this positive energy and good ideas. And this has just been really inspiring to see everything. And thank you once again to our presenters.
Thanks, Laura. Thanks, everyone. Thanks, Kate. Feel free to email me, United Way. Take care. Have a good day.
Yes, and we can definitely put your email addresses in the information we send out.
Sounds good. And I'll send you the reports.
All right, awesome.
Okay,
all right, take care, everyone. Have a good day.